This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Welcome into the program. I'm Dave Wilson. Our guest this morning is Shanice Forge, Provisional Licensed Professional Counselor. It is the holiday season, and for many, some folks get the holiday blues. That's what we're going to be talking about this morning. But first, as we always do, we like to get to know our guests just a little bit better. First of all, let's say good morning to Shanice. Good morning.
Good morning.
Appreciate you taking some time. We'll get into talking about the holiday blues, something that probably more people deal with than they like to admit. But first, we have to talk about you for just a moment. Tell us a little bit about yourself, your background, where you came from, where you went to school, and how you ended up with Mon Health.
Yeah, of course. So I'm originally from Clarksburg, which is about 30 minutes away from here. I went to school at Fairmont State University with, I got a bachelor's degree in science, in psychology, and criminal justice. For a while there, I went and worked the field in corrections, so I kind of got a unique journey because I was able to kind of see what I liked and what I didn't like. And in 2021, I was able to graduate from WVU with a master's degree in counseling and mental health, clinical rehabilitation. So it was nice because I was able to see what I liked and what I didn't. So as far as choosing Mon Health, there are so many reasons, so many positive reasons why. One, when I first stepped in to do my interview, it was just so welcoming. They shared a lot of the same values that I have, which is advocating for patients. It's a real opportunity to grow. So I really enjoy my time at Mon Health, and I'm happy to be doing what I'm doing every day.
What first attracted you to getting into counseling to begin with?
Okay, that's a good question. So growing up, not having those resources, not understanding what I was feeling and how to manage or control some of my symptoms personally, I kind of see that a lot of people don't understand when they're being overwhelmed or feeling depressed, and having the opportunity for someone to say, hey, it's okay to feel these ways, let's work through this, kind of opened my eyes to mental health.
So let's get into the subject today. It is we are officially now in the holiday season. Christmas is around the corner. A lot of folks have holiday parties. They've got family gatherings coming up. You got to get Christmas presents bought and wrapped and delivered, and there's a lot going on, Shanice. That is the bottom line. So when I say holiday blues, or when you say the holiday blues, what are we talking about? What are the holiday blues?
Okay. So, the holiday blues is typically associated with the acronym SAD, seasonal affective depression. So one thing this occurs around the colder seasons. This could be for multiple reasons, but we kind of see where individuals have like an elevated levels of anxiety and depression. And, they can manifest in so many different ways. They can feel loneliness, self-isolation, feeling fatigued, loss of interest in their activities, feeling high levels of frustration, etc. So it's good to be aware of those symptoms when they occur.
So just the season itself being it's winter, it gets dark early, it's cold. A lot more of us we're staying inside. We're not out, just hanging out in the neighborhood. You're saying that has a major impact, just not even considering the holidays, just the season itself.
Absolutely. You go to work in the dark, you come home in the dark.
Right.
That's a lack of sunlight, and sunlight is very imperative for your mental health.
So how, and we'll get kind of into the holidays in a moment, just so how do you combat or try to deal with that a little bit? Like you said, you go to work, it's dark, you get home, it's dark. How do you try to counteract just the seasonal element there?
Well, I think a lot of people, I don't know if you've heard of the UV light boxes. A lot of people do that. They'll do that a couple of days a week to kind of help with that. You know, with the seasonal, you know, just being aware. That's the first step. Being aware that, hey, this is affecting me is the best part. Having support around you, talking to someone about how you're feeling is another way to kind of help with those symptoms.
How does having, obviously Thanksgiving and then you have the holiday season here for the next, several weeks, how does that add to the already kind of seasonal changes and some of the things we have to deal with there?
So there are a lot of triggers, a lot of stressors related to, one, family gathering is a perfect example that you brought up. So a lot of disputes sometimes. There could be a person that you have lost that's missing, so maybe Thanksgiving's not the same. Also, having bad memories, going back home, feeling like you have to have these high expectations when you come to your family. Like, are you married? When are you going to have kids? Things like that put a lot of pressure on people to worry about what's going on. So that's a big trigger for a lot of people.
I was thinking about just some personal experiences when you lose family members. Well, I'll tell you right now, my grandmother passed away this year, just actually a few weeks ago, and she was the matriarch of the family. It's going to be different because Mama's not around. So how do you deal with that? How do you cope with that when you have these holidays, the first ones, especially when you lose a family member who's someone who's always been there around the holiday season?
I'm so sorry that you lost your grandmother. It's hard. It's going to take a minute for you to readjust to things because it's not going to be the same. If you're not ready for those steps, you can take time away from doing those activities if it's hard. But I strongly encourage, using your social support, using your family members to kind of say, hey, this is hard, and this is going to be different. Two heads are better than one, right? Mm-hmm. So, even practicing some frustration tolerance. If you need time to yourself or you need time away, take those moments because you're not being selfish. You're grieving.
Is it okay? I've heard this from people say, well, it's Christmas. I have to be jolly. We have to be happy. Is it okay to not be?
It is absolutely okay not to be jolly and not to be happy. That's another one of those triggers, the pressure to have unrealistic expectations. Not everybody is happy. There's financial worries. There's, the family dramas. There's, fatigue. There's so many things. One thing I encourage people to do is realize there are things in your control. You're allowed to say no. You're allowed to budget early if that helps you. You don't have to be jolly, but, practicing frustration tolerance is going to help you, and it's going to go a long way.
We're talking to Shanice Forge this morning, provisional licensed professional counselor. We're talking about the holiday blues, how to handle them, and we'll talk about how we can avoid them as well. We'll continue the conversation on the other side of this timeout. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Shanice Forge is our guest this morning, licensed professional counselor with Mon Health. We're talking about the holiday blues. And Shanice, just the holidays in general we talked about, can be stressful. There's gifts to buy. There are family gatherings to get to. Even if everything goes perfect, it can still be stressful. So how can you deal with that throughout the holiday season?
So fortunately, there's a lot of ways to help with that. I kind of named a few of them earlier. But one thing is having assertive communication. Don't put so much pressure on yourself. Tell people that you need help. Saying no to events, saying no to social events, that's a big one because it's one of those things where you kind of said earlier, I have to go, I have to do this. You're allowed to take some time for yourself. Another thing could be, with shopping and financial worries, creating a budget. Say you're going to put $30 away a month starting in August. That's the only money you use for the holiday season. So that way you make sure that you're able to meet your needs. Lastly, just self-care, taking time for yourself. I can't mention that enough, taking care of yourself.
The first thing you said there, communications, that just thinking back on some of the more, thinking back on personal experiences there, it's the lack of communication when you don't communicate, we need to be to, my parents' house by 6 o'clock for dinner, or if you try to subtly hint you want to do this, just communicate it, and it will avoid a lot of the triggers, as you said, that can lead to bigger, worse incidents, if you will. Am I on point there?
You're absolutely on point. A lot of times, anxiety and depression very prevalent during these holiday seasons, especially anxiety. So what is our go-to for anxiety? Absolutely. I'm just going to avoid it. I don't want conflict because conflict is bad. There is absolutely good conflict. There's good confrontation. And telling someone, hey, I just don't have the ability to come tonight, or maybe we can make a different day, is absolutely okay. It doesn't have to be A, B, and C. Allow yourself some options. Allow choices in this holiday season.
Is there a trick? A lot of folks will say, take a minute and sit back and enjoy it. Is there a trick to doing that?
So, there's a term we use, being mindful, staying in the moment. I think a lot of times people are so focused on, okay, so today's the 23rd, tomorrow's Christmas Eve, then Christmas, and I have to do A, B, and C. Well, yes, stop for a minute and focus on what's going on today. What do you see? Look around you. Stay grounded. Look at the beautiful lights. Admire the snow if there is snow. Take a minute. You're allowed to.
Talking to Shanice Forge, and we're talking about the holiday blues. Shanice is a provisional licensed professional counselor with Mon Health. So what are a couple of things people can keep in mind as we continue through here with the holiday season? Communications, you've mentioned, take a moment. Is it really just those simple things like that will prevent, and maybe even if we find ourselves in a situation where we're kind of feeling down or feeling overwhelmed, that can bring us back to center?
Yeah. I mentioned grounding techniques. That's where it brings you in, putting you back in that moment. Also, if you have coping skills, use those coping skills, whether it be listening to music, art, doing paint. Take time for yourself. Self-care is not just about getting a manicure or pedicure. Self-care is attending your ADLs, taking a shower, doing things like that, allowing yourself some peace during the holidays.
Do you find people will neglect themselves during the holidays because they're trying to get so much done for everybody else? Especially, I'm going to go out on a limb and say that mothers especially probably find themselves in that situation.
Absolutely. This is the time for giving, which means giving to others. Don't worry about yourself. Don't think about yourself is kind of what we've grown up with. That's kind of the ideology we have right now. Like, worry about everybody else because this is a time for you to be thankful and grateful and help others. But at the same time, in order to take care of others, you kind of have to take care of yourself first. And I think your remark about moms, they are the people that are like, I have to provide. I have to make this the best Christmas for everyone or best holiday for everyone. And they kind of get left out sometimes.
Talking to Shanice Forge, provisional licensed professional counselor. Got to take one more break. We will continue our conversation, wrap things up right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Shanice Forge is our guest this morning, provisional licensed professional counselor with Mon Health. And Shanice, what kind of services are available with you and through Mon Health?
So here at Mon Health, we are a little small community called Wedgewood Psychiatry. So we offer counseling, therapy. We have a couple of med providers that are really great. So, anytime that you would want to talk about these things or this is a safe space for everyone to, to talk and decompress and, get some tools that can kind of help them strategize through the anxiety and the depression.
Where are you all located, your offices?
We're on Medical Park Drive. We're like the first one on the right. I think it's Suite 1201.
And how can people get a hold of you?
Well, there's a website. It is monhealth.com/psychiatry, and you can also call in as well.
And do you take, I don't say walk-ins, but new patients? Can you just call and make an appointment and we'll go from there?
Yeah, you can call and make an appointment, and our receptionist will get with you and coordinate things so we can meet up.
All right. Got a couple of minutes left here. What is the one takeaway you want folks to remember from today's show as we go through the next couple of weeks?
The main takeaway is that you can have a good time at the holidays, but, having realistic expectations. You do get tired, and you can feel like it's overwhelming, and that's okay. Just knowing and understanding that you have control.
I was just grinning there, thinking about the expectations, and Clark Griswold came to mind, Shanice, how he wanted to have the perfect family Christmas, and everything goes wrong. I don't know if this is a great comparison or not, but I'm just thinking, you know what? That is probably closer to reality than the Hallmark movie Christmas, right? That seems to me like that's probably a little bit closer to what a lot of people deal with around the holidays. You want perfect, and you get squirrel running through the living room.
Exactly.
And there's nothing wrong with that, right?
Yes, there's nothing wrong with that. Your family is unique, and so are you. So why can't your Christmas or holidays be unique?
That's where you just sit back like Aunt Bethany and watch it all unfold and have fun with it.
Exactly.
Well, Shanice, I appreciate the conversation this morning. And again, you can go to monhealth.com/psychiatry for more information. And can you give your phone number one more time?
It is 304-599-1765.
I appreciate that. And again, that's how you can get more information or reach out. Shanice Forge, provisional licensed professional counselor. Appreciate the time very much this morning, and happy holidays to you this year.
You as well. Thank you for having me.
Absolutely. Thank you very much.